Hello guys, welcome back to the channel. It's Unit 10 Part C. Infection site in neonate babies. In eyes, ophthalmia neonatorum, infection in skin, in umbilicus, in oral cavity, oral trache is the common condition, respiratory tract infection. In blood, septicemia means sepsis, the infection of the blood. In cranial system, we have meningitis and IVH condition and intra-abdominal infection. Now let's see everything in a brief manner. First, ophthalmia neonatorum. This is the infection and inflammation of the conjunctiva, the eye part, and this occurs in the first 3 weeks after the birth. It is caused by the chlamydia trachomatis, and apart from this, even because of bacteria like staphylococcus, pseudomonal, pneumococcal, and chemicals like silver nitrate. Overuse of this silver nitrate can cause. If it is used in a normal level, no need to worry, it will not lead to infection or inflammation. And virus like heparis virus, that is type 2, because of this the ophthalmia neonatorum is caused. At the time of delivery, because of the vaginal discharge, the baby might get this condition. So soon after the birth, we need to clean the baby well. And one thing, at the time of birth, the baby will be closing its eyelid, so we need to clean it thoroughly even it is closing its eyes. And if we follow a aseptic manner of delivery process, that is if we follow the high level of hygiene level in the delivery process, this condition can be eliminated. To cure this, we use a solution known as tetracycline or soframycin or 1% silver nitrate eye drops. By using this, within few weeks or within few days, the baby gets cured from this condition. Skin infection. In skin infection, the common condition is Pemphigus neonatorum. This is nothing but acne like thing, a small spore like things will occur in the skin in the reddish color, and it is caused by an bacteria known as Staphylococcus aureus. Next, umbilicus sepsis. This is infection and inflammation in the umbilical region, and the bacteria that causes this condition is Staphylococcus, E. coli, tetany. This all causes this condition, and because of this condition there will be a discharge in the umbilicus, and this condition even delays the fall of the cord from the umbilical. Next, oral trache, and this is a condition where there will be a fungal growth in the oral cavity. In the buccal region and around the trunk, there will be a fungal growth by the Candida albicans, and this fungal growth will form a milky curd like texture in the mouth. If you try to wipe, it will not come out. That is oral trash. Sepsis. This is the infection of the blood, and this condition is so threatening that it can take the life of the baby. It can occur because of bacteria or virus, but generally it occurs because of the drug uses. If mother is using lot of drug, or there is a lot of drug or chemical exposed to the baby, then automatically the baby gets this condition. And those chemicals which are released in the baby's body will start to spread, but baby's body try to stop it by producing antibiotics, but still baby's body, the organs present inside it, is so delicate that it can't win those chemicals. The chemicals start to damage those organs. By damaging those organs, it leads to the death of the baby. This is sepsis. Meningitis. Meninges is a fluid that is present in the brain and the spinal cord. If there is any infection occurring to that fluid, that is known as meningitis. So in commonly, meningitis is an infection and inflammation for the brain and the spinal cord membranes, and it can be caused because of bacteria and fungus, but generally it is caused because of viral infection. There is a vaccine for it. By taking the vaccine, we can prevent this meningitis. IVH, intraventricular hemorrhage. It is a condition where the bleeding is seen in the cranial region. It is also known as intracranial bleeding, and this condition is seen because of any problem in the delivery section. If they use any forceps delivery and the baby's head is injured, or in the delivery process if fetus has any distress, because of this condition the IVH occurs. And when this condition occurs, the baby will get respiratory problems too. So as a management, we will first support the respiratory system and then circulatory system. If there is a problem in the respiratory system, then automatically there will be a acid base disturbance. For that correction, we will provide the medications, and this medications, this supply, everything will be provided to the baby in the NICU. That is a special unit where the baby will be given care. And one thing, this condition will not cause the permanent damage in the brain. It can be cured, but if it's very 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 serious, then it can even lead to death or permanent neurological disorder. The baby can't walk or some kind of problems. This is IVH. Next, intra-abdominal infection. This is the infection in the GI system, and one thing, it is caused because of microorganisms. If you are not taking care of this condition, it can spread from one part to the other part of the GI system. Respiratory problems: apnea, meconium aspiration, athalescence, idiopathic respiratory distress syndrome, bronchopulmonary dysphagia. These are the conditions. While apnea is nothing but the absence of breathing or cessation of respiration. That is nothing but, if you see, if a baby is crying for a long time and suddenly there will be a pull of respiration, that is apnea. That is how the apnea is seen. This apnea will be most frequently seen in the babies, and gradually the length of the apnea will be increased, first for 10 seconds and then gradually for 20 seconds and even more longer. If the condition is getting worse, then automatically there will be a symptoms like color will be changing in the baby's body, like bluish discoloration, and bradycardia will be seen very often. That is apnea. And we have meconium aspiration. When the baby is inside the womb at the time of birth, in this time the baby might intake the meconium. Generally in 5 to 10% of birth, this condition is seen. That is meconium aspiration. It can be seen either in the full term baby or preterm baby. Atelectasis. This is a condition where the lungs is collapsed either partially or fully. The collapsed lungs is actually filled with the fluid. In this condition, if the child is not treated properly, the treatment is not given properly, it may lead to death. And next, bronchopulmonary dysplasia. In this condition, it is a chronic pulmonary disorder, which means the lungs is filled with fluid, and this fluid which is filled in the lungs leads to edemas, and this condition can be treated with oxygen therapy. Idiopathic respiratory distress. In this, the child is suffering from respiratory disorder, but the exact reason is not known. Generally in premature babies it is seen, or the babies whose mother has diabetes, or the baby who has born through C-sections. In these babies this condition is seen, and this condition lasts for 3 to 5 days. These are the respiratory problems. These are the possible questions from this chapter. Meet you in the next video. Until then, stay tuned. Bye.